Hi friends, in this video we will see about rhythm on ECG. So before we look for rhythm, we should observe what is the heart rate, whether it is 60 to 100 or complexes falling at regular intervals. Each P wave and QRS must be 1:1 and QRS of normal or wide, and whether PR interval is normal or not. Usually rhythm is regular, rate is 60 to 100, P waves are upright and regular, and each P wave has one QRS, and PR interval is 3 to 5 small boxes. QRS is 3 boxes. Arrhythmia is disturbed automaticity. Whether sinus node is faster or in place of sinus node, other node can AV node can take over for rhythm. And whether disturbed conduction is there or whether blocked conduction through the bundle branch are there, they will also cause arrhythmias. Both rate and conduction are affected in some cases. So this is normal sinus rhythm. This is sinus tachycardia where heart rate is more than 100 beats per minute. Rhythm is regular. Before each QRS, one P wave is there and identical, and PR interval is 0.1 to 2.20 seconds. QRS is less than 12 seconds. This is sinus bradycardia, which shows heart rate less than 60 beats per minute. Rhythm is regular. Before each QRS, one P wave is there and PR interval is 0.1 to 2.20 seconds. QRS is less than 12 seconds. This is pulseless electrical activity on ECG. There is no pulse in patient. We should give CPR or epinephrine, but we should not give shock in these patients. Supraventricular arrhythmias, if we draw one line below the AV node, above this is supraventricular, this is ventricular. Impulse crossing AV node always gives narrow QRS and broad QRS is seen in ventricular arrhythmias. Which arrhythmias are supraventricular? Premature atrial contraction, atrial fibrillation, atrial flutter, and re-entry tachycardia. PAC in an otherwise normal sinus rhythm, P wave is upright in front of QRS with abnormal P wave and abnormal PR interval. A single complex occur earlier than next expected sinus complex. This is one PAC. This is one PAC. After the PAC, sinus rhythm usually resumes. Rate depend on rate of the underlying rhythm, and rhythm is irregular whenever a PAC occur, and P waves present in the PAC may have a different shape, and PR interval varies in PAC or otherwise normal also 0.1 to 2.20 seconds. QRS is normal. This is premature atrial contraction. This is now altered P wave with altered PR interval, and before normal rhythm it has come. Atrial flutter. Atrial beating is very fast. Not all beats conducts through AV node. Atrial contraction is either 2 times or 3 times to the ventricular rate. This has classical appearance of sawtooth appearance. Rhythm is regular, can be irregular. Rate is 110 beats per minute. P waves, flutter waves, or F waves are present. PR interval F waves are consistent. 2 for every QRS, and QRS is normal range 0.12 seconds. Atrial fibrillation. Atria firing at faster rate, no P wave at all. Irregular rhythm with narrow QRS, and P waves are absent. So variable RR interval with narrow QRS and absent P waves. Rhythm is irregularly irregular. Rate is 120 to 180, and P waves or PR interval not present. Chaotic fibrillatory waves are present, which are not measurable. Next is supraventricular tachycardia. This is narrow QRS with regular P wave is not visible. T waves are present. T waves of previous QRS are visible. So this is T wave of previous QRS. Rate is more than 180. Usual rate is 150 to 250. Rhythm is regular. P waves frequently buried in the preceding T waves and difficult to see, and PR interval usually not possible to measure. QRS is normal. This arrhythmia has such a fast rate and that P waves may not be seen. So PSVT, if stable, we should give Valsalva. Still PSVT, any contraindication to adenosine? If it is no, then adenosine higher dose. Then still PSVT, any contraindication to CCB is no. CCB is even after high dose, still PSVT present. We should go for cardioversion. Adenosine 6 milligram IV or 12 milligram IV if needed. Time to conversion 1.48. Calcium channel blockers verapamil 5 to 10 milligram IV, 1 milligram per minute or 5 milligram over 5 minutes verapamil. Time to conversion is 6.5 minutes. Thank you.